Anemia is a condition in which the of red blood cells is low. Red blood cells contain hemoglobin, a protein that enables them to carry oxygen from the lungs and deliver it to all parts of the body. When the number of red blood cells is reduced, the blood cannot carry an adequate supply of oxygen. An inadequate supply of oxygen in the tissues causes the symptoms of anemia. The causes of anemia are numerous, but most can be grouped within three major mechanisms that produce anemia. Anemia due to excessive bleeding. Anemia may be caused by excessive bleeding. Bleeding may be sudden, as may occur as a result of an injury or during surgery. Often, bleeding is gradual and repetitive. Chronic bleeding, typically due to abnormalities in the digestive or urinary tract or heavy menstrual periods. Chronic bleeding typically leads to low levels of iron, which leads to worsening anemia. See iron deficiency anemia. Anemia due to inadequate red blood cell production. Anemia may also result when the body does not produce enough red blood cells. See also formation of blood cells. Many nutrients are needed for red blood cell production. The most critical are iron, vitamin B12, and folate, folic acid, but the body also needs trace amounts of copper, as well as a proper balance of hormones, especially erythropoietin, a hormone that stimulates red blood cell production. Chronic inflammation, infection, or cancer also may suppress red blood cell production. Symptoms of anemia. Symptoms vary depending on the severity of the anemia and how rapidly it develops. Some people with mild anemia, particularly when it develops slowly, have no symptoms at all. Symptoms are more severe when mild or severe anemia develops rapidly, such as when bleeding occurs when a blood vessel ruptures. Mild anemia often causes fatigue, weakness, and paleness. In addition to these symptoms, more severe anemia may cause faintness, dizziness, increased thirst, sweating, a weak and rapid pulse, and rapid breathing. Some symptoms may also give clues to the cause of the anemia. For example, black tarry stools, blood in the urine or stool, or coughing up blood suggests that anemia is caused by bleeding. Dark urine or jaundice, a yellowish tinge to the skin or the whites of the eyes, suggests that red blood cell destruction may be the cause of anemia. A burning or prickling feeling in the hands or feet may indicate vitamin deficiency. Anemia in older adults. Many disorders that cause anemia, such as cancer, including blood cancers such as myelodysplastic syndrome and multiple myeloma, tend to be more common among older people. Anemia of chronic disease, caused by chronic inflammation, infection, or cancer, and iron deficiency anemia caused by abnormal bleeding are the most common causes of anemia among older people. Anemia is not a normal consequence of aging, and a cause should always be sought when anemia is identified. Symptoms of anemia are basically the same regardless of age. Also, even when anemia is mild, older people are more likely to become confused, depressed, agitated, or listless than younger people. They may also become unsteady and have difficulty walking. These problems can interfere with being able to live independently. However, some older people with mild anemia have no symptoms at all, particularly when anemia develops gradually, as it often does. In older people, anemia caused by vitamin deficiency may be mistaken for dementia because this type of anemia may affect mental function. Diagnosis of anemia. Blood tests. Sometimes anemia is detected before people notice symptoms when routine blood tests are done. Low levels of hemoglobin or a low hematocrit, the percentage of red blood cells in the total blood volume, found in a blood sample confirm the anemia. Other tests, such as examining a blood sample under a microscope and, less often, examining a sample taken from the bone marrow, help determine the cause of the anemia. Treatment of anemia. Treatment for the cause of anemia. Blood transfusion if needed. Treatment of anemia depends on identification of the cause. For people with excessive bleeding, stopping the bleeding is most urgent. For example, if a wound has significant bleeding, pressure can stop the bleeding and surgery may be needed. Bleeding in the gastrointestinal tract, such as from an ulcer, can often be stopped by endoscopy or other measures. Chronic uterine bleeding may require, for example, oral contraceptives or removal of uterine fibroids. Inadequate production of blood cells is often caused by an inadequate amount of a vitamin or nutrient required to make blood, such as iron or. People whose red blood cells are destroyed prematurely, hemolysis, may require treatment with drugs that suppress the immune system. Ultimately, If the anemia is severe or causes symptoms, blood transfusions may be needed and can be life-saving. Anemia is a condition in which the of red blood cells is low. Red blood cells contain hemoglobin, a protein that enables them to carry oxygen from the lungs.